Welcome to our class on women's reproductive hormones. Women are complicated. Men are pretty simple. Testosterone, straight across, same every day. Women, we change every day. Our hormones are different from day to day. So it all starts with the brain in the pituitary gland. The pituitary releases a hormone called follicle-stimulating hormone, FSH. This hormone sends a signal to the ovary to start the ovulation process. The eggs in the ovary get a follicle around them. The follicle is like a casing for the egg. And that follicle produces hormones. What actually happens is several follicles start to develop with eggs inside them. And then one becomes dominant. It becomes mature. It gets big enough to ovulate. That follicle produces a hormone called estrogen. Estrogen raises as the follicle is maturing, and then there is a dip. At the time of this dip, it signals the brain to release luteinizing hormone. And that's the hormone that causes the egg to be released from the follicle. That's ovulation. So here's the egg being released from the follicle. The follicle, which is the carrier for the egg, becomes a corpus luteum. And that corpus luteum then picks up the process of making hormones. It continues to make more estrogen. And it also makes progesterone. If no baby implants, then the progesterone and the estrogen drop because the corpus luteum dies. The corpus luteum lives for a set amount of time, about 12 to 14 days. And then that sends a signal back up to the pituitary gland to start over with the follicle-stimulating hormone. And this whole thing starts over again. The other thing that happens is the uterine lining thickens when the estrogen is rising. And then when the progesterone is made, it becomes mature, it becomes more vascular. And that allows for a baby to implant. Now, if you have polycystic ovarian syndrome, you may not make a dominant follicle. You may not make a mature follicle. You may not have a normal ovulation. If you don't have a normal ovulation, you aren't going to get these hormones made. Some of you might have ovulation, but you don't make enough progesterone. Your corpus luteum isn't very strong. And so you may not get maturity of your uterine lining either way if you don't ovulate or if you don't make enough progesterone. And that's when you get heavy bleeding or irregular bleeding because the uterine lining gets too thick because it doesn't have progesterone to make it mature. So you can see that this is a complicated process and there's a lot of parts to it. When you're charting your cycles using the Creighton model, we're able to measure hormones at the right time of the cycle, and we know what they're supposed to be on a daily basis. So we can tell if you're making enough hormones in the beginning part of your cycle and in the second half of your cycle. We are wonderfully made. Thanks for your attention.